Hello once again. We are at the Theriogenology Conference and Symposium in Milwaukee, and we're visiting right now with Dr. Jim Ferguson with the University of Pennsylvania, the School of Veterinary Medicine there. Dr. Jim, can you tell us a little bit about your background as we begin?
Okay, Gary, I'm a Penn graduate, 1981, and worked in first a mixed animal practice in South Central Pennsylvania for a year, and then joined a dairy-only practice in Southeast Pennsylvania. And through the practice experiences, I got interested in the relationships between nutrition and reproduction, and also reproductive management programs on dairies. And so went back to Penn, did a residency in nutrition and then a residency in theriogenology, looking at protein and the effects of fat on fertility in dairy cows. And in brief sojourn at Cornell and position in the animal science department, and then came back to Penn in 1990.
Now, I have been told by some other people here at the conference that one of your strengths is taking a very complex issue and I guess finding the lowest common denominator to make it as simple as possible to put in information to get the desired results, or at least get a result to find a cure, if you will.
Well, I've been fortunate when part of my training at Penn and then coming back to Penn, the university started in the vet school a Center for Animal Health and Productivity. And part of the focus of that was to look at problems on dairy farms and examine cost-effective solutions, especially as related to veterinary services. And so within our group, we had an economist who did an MBA at Wharton, ruminant physiologist, also a mathematician, statistician, and so we had a rich resource of people to work with to look at a little more involved techniques to try and answer questions. And so I was very fortunate in the environment we had at Penn.
I know that a lot of our dairy farm viewers right now are curious to what the answer to my next question might be. Of course, we all know that dairy operations have gone through increasingly hard times, economic challenges, I guess is the way to say that. Where do you see the dairy industry with research that's coming? You've listened to a lot of research here. The future of the dairy industry, is it on an upward trend, do you think?
Boy, that's a good question. If we look at trends over the last 50 years, we see the industry consolidating, fewer herds, larger herds. I think we've gone from a little over 1 million farms in 1950 down to about 70,000 farms in around 2008 or so in the country. 21 million cows down to about 9 million cows. But production per cow has greatly increased. And we see that trend probably will continue because of the economics of the dairy industry, herds getting larger. There may be some small niche farms that will survive in urban areas providing specialty products, organic milk or milk from grazing cows that will provide a niche for consumers. But in terms of general, what I call commodity production, maybe it's not a good word, but I think we'll see larger dairies producing a large amount of milks in the U.S., but that industry is going to consolidate.
Well, large and small operations depend a lot on research. With the present situation, and I realize we may have some questions and we may not know exactly where particular funding monies are going to be coming in the near and possibly the long-term future. Where does that put someone like you and your colleagues, not only at the University of Pennsylvania, but other colleges and universities in this country, as far as necessary monies to continue this desired research?
It's a challenge. We've seen, what I've seen happen, I guess, in my area is for people to get funding, they've gone more basic in their approach, more molecular biology and basic mechanisms. To attract funds from government sources. Our group has gone the opposite direction. Are looking more at the whole farm system. And some of our funding has come with some of the challenges with environmental impact of farms and looking at the environmental footprint of dairy farm operations. And so we've tended to go more to a systems approach in some of our research. And also we're doing a lot more work globally. We've got projects going on now with several universities in China and looking more at what's the challenge in the food supply over the next 50 years? How are we going to increase the availability of livestock products without wrecking the environment? And that's a huge challenge for the industry. And we need also research in that area. It really looks at the organization of farm systems and coordination of those farm systems with the environmental footprint.
Now, specifically here at this conference, you were presenting to your colleagues some research that you've done, finding that some proteins that you found in the blood, some of those tests might be good to use in a certain operation, and other tests could be good to use. It depends on the particular operation.
Yeah, we looked at, and part of what our group has done over the years has been looking at cost-effective programs for the dairy producer on reproductive management. And over the years, we've looked quite a bit at different approaches. And one of the things we were looking at for this meeting was the three main tests that are used in the field to diagnose open or pregnant cows, either rectal palpation or ultrasound or the blood pregnancy protein or the bioprint test that's been available for 3 or 4 years. And we examined different approaches to looking at, say, ultrasound exam at 28 days post-breeding, blood pregnancy test at 32 days, rectal palpation at 35 days. Do that weekly, bi-weekly, or monthly, and what is the most cost-effective approach for a farm, given different levels of heat detection within herds. And
so I imagine the various challenges that you have, or the various operations have, it depends much on what would be best for them, each individual operation.
Yes, and what we found was, in general, given the sensitivity specificity of the tests, that they're actually very similar, that what would be most cost effective really comes down to what's the utility for the producer. Working with their veterinarian, what would be the most optimal test. And there's a definite trend, or not a trend, but a definite preference for the blood pregnancy test in small herds, where if they want to try and manage a more precise pregnancy diagnosis program or open diagnosis program, if they want to do that weekly and they're testing less than 10 cows, that it would be better for them to do a blood pregnancy exam. But once above the 10 cows per week, that it's then what's the utility to the farm.
I see. Well, Jim, I know that we could talk at length on some of these things. Some of our viewers that are watching right now and would have some questions, what would be the best way for them to get in touch with you?
Probably through email. At the University of Pennsylvania, we have a website for the Center for Animal Health and Productivity, and that provides our emails and also provides some information on some of the work that we do.
And we will be putting that on our website. In fact, you can look at it at the bottom of the screen right now, in a way in which you can get in touch with Dr. Jim Ferguson with the University of Pennsylvania. Thanks for being with us.
Thank you, Gary.
And stay with us. More to come right after this.